So tomorrow also I'll take class, Kartika. Yesterday, as I have not taken that class, I will take tomorrow.
Okay, ma'am. Ma'am, how is your son now?
Yeah, now he's fine. He got viral fever, Kartika.
Oh yeah, now everyone is having here also.
Now, like he got some rashes on the face. He's not well
Oh,
yesterday, but from 2 days, like from day before yesterday night only, he's not feeling well. And by today, he is little bit fine, not fully recovered. Today also, I should go to hospital evening.
okay, ma'am.
Once again for the checkup, I need to go. Here for every like for all the kids, they are suffering with the same
Oh,
rainy season. No, that too. Suddenly climate was
yeah,
changed.
from school and everywhere.
It is common in this season. But what happened is 3 weeks back, continuously there was rain. Continuously for 3 weeks there was rain, and suddenly sun is coming.
Yeah.
Maybe due to that drastic change, these all things are happening, and some virus is also there since now.
Oh,
So previously we learned, like in previous class, we learned about the DMP plan, data management plan for paper-based studies, right?
paper.
So
Yeah.
now I'll show you EDC-based studies. All the first common things, and I'll show what are the difference between this one. These all are common. Okay. So this is the one. Here in EDC based studies in DMP, we'll mention what is the electronic system used in the trial. So it is an FDA requirement that documentation exists for each trial, which identifies what software is used in computerized systems to create, modify, maintain, archive, retrieve, or transmit data. But what the thing is, previously, like before we get some regulations, previously all the data we used to maintain paper based only, but FDA has changed its regulations to maintain electronic systems as much as possible. Like if we have possibility, maintenance of electronic systems is good because we'll not miss out any of the data, because in paper based studies, maybe due to if any natural calamities, if some things happen, we may miss all those papers, right?
Yeah.
That's the reason here they have taken a new regulation that EDC has to be used in order to maintain the documents in a safer way, like that they mentioned. And from that time, for most of the studies, that too, if it is a pan India studies or if it is a global studies, then mostly for those kind of studies, electronic systems will be used. So here we'll mention what is the electronic kind of system we are using for that particular study, and what is the version of that electronic system, and who is the vendor for that one, and what is the purpose. So, as I said, in our company, we'll be using some tools, and for that particular study, we have used Clinevo EDC, but we'll have so many also. As I said, I
Yeah.
have sent you some videos also, right?
Yeah,
So,
ma'am.
GigaVault will be there, Rave will be there, Clinevo will be there, Clinops will be there. Like that, so many tools are there. Based on the budget or based on the scope of that study, they will be using some particular tools. So, those all things we have to mention in the data management plan. And as I said, you in paper based studies, what will happen first? The CRF will be developed by the medical writer, then that CRF will be reviewed by the DM team, and directly it will be sent to the site for the usage. But here in data like in EDC studies, it will not be the case. What will happen is, first, generally as like paper studies, CRF will be designed by the medical writer only. Once the medical writer designs the CRF, it will be reviewed by the DM team. From DM team, it will go to the database developer, because database developer has to enter the whatever the provisions that were given in CRF, whatever the data that has to be entered by the site. Those all things he has to design in a tool, right? That's the reason
Yeah.
that will be shared with the database developer. The database developer, what he will do is he will design the database in such a way that whichever the points are there in CRF, that can be captured electronically through this tool. Like that, he will design. After he designs the database against user acceptance testing, that is called as UAT. UAT will be performed again by the CRO team. That is called as user acceptance testing. Okay. In this one, how it will be is like a dummy kind of database they will give to us. And
Okay.
in the dummy kind of database, we'll enter whatever the data we want to enter or whatever the information we'll enter generally in the CRF. Those all kind of things we'll enter in the database, dummy database, and we'll see whether it is working or not.
Okay.
Okay? Like a try
So
kind
my
of.
first it will be written designed by medical writer. Then will be
CRF will
sent
be
to the
designed by medical writer.
okay. Then it will be sent to data management team.
A data management team for review the CRF, because CRF will be designed as per the protocol, right? So
Yes.
that will be designed by medical writer. Then DM people, they will check whether that CRF is as per the protocol or not. Again, DM team will check, and once they once they feel that okay, this is okay, then they will send again to medical writer, and medical writer will give the PDF document as a final one. That final CRF will send to database developer.
Okay.
Okay. Then database developer, however the data is there in CRF, like that, he will design the tool, and he will share that dummy tool to site to CRO team. Again, to check whether that whichever the data we want to enter into the CRF is there in the tool or not. To check that one, they will send the dummy tool to us. In the dummy tool, we have to perform this UAT, that is user acceptance testing. So whether whichever the data we have present in the CRF, that is present in the tool or not, it is working properly or not. Those all things will be checked by the CRO team through the UAT process. Understood?
Yes, ma'am. Yes.
Okay. So once we confirm that through the UAT this tool is working, and whatever the data we have given in the CRF, it is present in the tool or not. Like this all information once we give, then they will keep some edit checks in the database. As I said, you edit checks are nothing but some compulsory things which we have to keep in the protocol. For example, site visits will be there. First visit should happen on day 1. Second visit should happen on day 14. Third visit should happen on day 30. Like that, we'll have some particular days to visit to the patient. So here they'll keep the edit checks. Visit 1, day 1. If we are entering the date of day 2, it will not take. Like those kind of automatic edit checks, they will keep in that EDC tool. Understood?
Yes, ma'am.
Okay. So once after entering this all kind of edit, because and here what it will ask is, if, for example, if you are entering the separate day, then it will raise a query, and then you can keep a protocol deviation for it. You can mention that the protocol deviation was fine, then it will accept to enter the data in that particular date. Okay. So like that, they will design the database, and after user acceptance testing and after this edit checks are kept, everything are ready, then it will go for live. Live is nothing but it will be sent to sites. 1 minute, Karthika. Okay, no problem.
Yes, ma'am.
So once is all things are done, then it will go live. Go live is nothing but it will be sent to site team for their uses.
Okay.
And for EDC studies mainly, we'll have some ECRF completion guidelines. So we have to know what those guidelines are. Let's see. Right. And essay reconciliation, protocol deviation, same as I explained you for paper-based study. Those all remain same. Only for the EDC studies, you should know what is the tool and what is the meaning of UAT, then CRF completion guidelines. Okay. So now I'm showing you the CRF completion guidelines. Okay. The CRF completion guidelines is the first one. Like when we are entering data in the CRF, the first data is the general data. In that one, we have to enter visit date of the patient, date on which patient has signed the informed consent form, date on which the investigator has signed the informed consent form. Like that, we have to enter some dates in the CRF. Okay, those dates in the EDC we should not enter manually, like 12-12 like that. We should not enter there. They will have a calendar. We should open the calendar and there we have to select the date.
Okay.
Okay. Next.
Yeah.
Subject initial, screening number and UN number, that should be entered manually.
And
Next, CRF must always be completed by the authorized site personnel. So we'll have one log called as delegation log in the site. In the delegation log, they will mention which person has to perform which duties. For example, from site, this person has to, his responsibility is filling the CRF and entering the data of CRF into EDC, those kind of thing. Next person, his duty is taking samples from the patient. Next person, his duty is submitting the documents to ethics committee. Like that, we'll have one log that is called as delegation log. So as per the delegation log, whoever the person is delegated to enter the data in EDC, that person only should work on the CRF.
okay.
It should not be given to whoever the person they want. Whoever the specific person what has a specific work is to complete the CRF, that person only should work. Okay. Next step. Ensure data entries are consistent with the source data. So like again and again, whenever they are entering the data, they have to cross check whether they are in line with the source data or not. Again, if site people are entering by mistake also, we should cross check along with the source data and we should confirm whether these are as per the source data or not. Like that, we have to cross check everything and no mistake should happen in entering source data to the CRF. Wrong data should not be given. Fields that are masked with asterisk are mandatory. In some fields, they'll keep star mark. So that data compulsory we have to fill.
Yeah, okay.
For all yes or no questions, yes or no will be selected from the options provided. That is fine. Next, demographic data. Same for the age. In demographic data, we'll mention age and gender. So in that one, for the age, same from the calendar, we have to select date of birth. Next, gender, drop list will be there. Anthropometry. In anthropometry, we'll have one that is BMI. BMI, we have to calculate to the patient. That if it is a paper CRF, we have to take the height and weight of the patient and we have to calculate the BMI by using the BMI formula. But if it is a EDC study, they will ask you height and weight of the patient data. If you enter the height and weight of the patient, automatically it will only calculate and it will give you the BMI of the patient.
Okay.
That one you have to enter in the BMI drop down box. Okay. Next, other baseline parameters like their occupation, duration of particular diseases. These all things we have to enter manually. Ethnicity also we have to enter manually. Even lifestyle habits also. Next, comorbidities also we have to enter manually. And as I said, whenever we are mentioning medical history, prior medication or con medication, if it is ongoing, we have to keep yes. If it is not ongoing, we should keep no. But by default, in prior medication, we have to keep no for ongoing. Understood?
Ma'am, can you explain it once more?
I think I have sent you one CRF, right? In
Yeah.
the CRF, they will mention like prior medication. We'll write the
prior and con
prior
medication.
medication and con medication. In the prior and con medication, there will be columns like what is that medication, whether it is ongoing. Ongoing, they'll give two drop boxes, yes or no.
Yeah.
What is the start date of that medication, stop date of that medication. So for medical history, for concomitant medication, we can enter as it is. But
Okay.
for the prior medication, in ongoing, definitely it should be no.
Okay.
Okay. Even though now the patient is taking that medication, now we have to keep it as no. In stop date, we have to mention the date of which patient has enrolled. That will be his stop date. And those all details again we'll enter in the concomitant medication. And in concomitant medication, ongoing can be yes. Start date should be the date when the patient has enrolled.
Okay.
Got it? This we
Yes.
have to remember very pakka, because in EDC studies, automatically it will raise you the query if you are keeping it as ongoing yes in prior medication.
Okay.
Okay, that's fine. And these all things. For some of the things we'll have drop boxes. For some of the things we have to enter manually, that we can easily understand by seeing the tool. Even I'll show you the screenshots of those tools. Mm. Okay. So this is the screenshots of the tool, and here I'll show you, then you can see in the YouTube video also and you will understand. Okay, so the first one here, it will ask you the login ID and password. In login ID we'll have a login, a username will be our name only, and enterprise, in whichever the company we are working, that company name will be the enterprise name. Once
Okay.
we enter into that, we log in into that by entering the username and enterprise name, then it will show like this: electronic data capture, metadata repository, even it will give trial master file, like that it will show. But DM people will work on only EDC, electronic data capture. These all different, these all metadata, TMF, these all belongs to operations team. They will work on it. So your work is only on EDC tool. In one tool only, different activities will be there. So we have to select our activity only.
Okay.
Okay, if you are, for example, you are data management person, and wantedly, if you are opening this metadata or other data, it will lock your profile.
Okay.
Like this, we should not see other department data. Okay,
Okay.
because when they are giving you username and password, they will restrict you to one tool only.
Okay.
So if you are trying to open other tool, it will lock you. Okay, so that kind of
Yes.
mistakes we should not do. Next up, once after entering into EDC, here these are the options: clinical trials, production, epidemiological. Next, discrepancy management, medical coding, data review expert, reports. So here, when we want to review the documents, review the data, we have to go to clinical trials. If you click the clinical trials, these are the sub options: production and epidemiological. Okay, so in that
Okay.
production you have to take, because the data whichever entered by the site, that tab is called as production. So you have to go to production. Then in once you are entering into the production, it will show you different sites which are involved in the study. Then you can go into each site and you can review the data. Got it?
Yes, ma'am.
And here, whenever you are raising the queries, you like again going into each site and checking those queries, it will be a time taking thing for you. That's why simply you can click this discrepancy management and you can open there. In discrepancy management, whichever the discrepancies or whichever the queries you are raising to the site team, that will be shown automatically. The like whether it will show you whether the discrepancy was resolved or not. That or you can open and you can if it is resolved, just you can tick that one, then it will be it will be saved. Site people, they will resolve and they will save that one. You also have to validate it, whether they have entered correctly or not. If they have entered correctly, one tick mark will be there. That tick you have to give. It's the meaning that this is resolved. Understood?
Okay.
Okay.
Yes.
Next is medical coding. In medical coding, mainly medical like for diseases which are, like for example, if you say in medical history, in medical history there will be data of patients, many diseases data will have name of the disease, like those kind of things. So for those diseases we'll give some code. For example, diabetes mellitus, DM, hypertension, HTN. Small codes we'll give for each disease, such that we can concise the data. Okay, like that kind
Okay.
of coding you can give by going into medical coding. Next, data review. data view. So once all the queries are resolved, you can go to data view and you can check whether all the data is proper or not. Once the data is proper, you can export the data. If you click this export data, you will get that extracted Excel sheet, which I have shown you in previous class.
Okay.
That extracted sheet, again, you can send as like you can that is nothing but the report. So that report, again, you have to cross check and you can share with the sponsor or sponsor. We mainly will share the data with sponsor only, to no one will share. Okay, so this is the options that are present in that. Next. Here, as I said you, if you click the production like this, you will get site codes, site 1, site 2, site 3. Whichever the site you want to check, that there at the code you have to click, then you will get the data of the subjects. See here, subject code, subject name. Is my screen visible?
Yes, ma'am.
Because I am showing small tabs for you. This one. So here it will be subject code, subject name, initials, gender, date of birth, age, subject status. Like that, after entering one person data, again here one box will be there, add subject. For the next subject, add subject, we have to click and we have to enter the data. And if you want to edit any data in this one, here you can see this pen like one action that you can click and there you can edit the data.
Okay.
Next step, schedule visits. Here also, like visit start date, it will show, even time also, visit start date and time. Next, see here automatically, as I said you, that database developer, he will
develop according to the
visit 1 day 1, visit 2 month 3, visit 3 month 6, visit 4 month 12. Like that he will schedule. Once if you are entering the visit 1 data, automatically it will take the dates of all other visits based on these dates, based on the dates which you have given. For example, visit 1 you have given on 9th August 2024. Okay, then visit to date month 3, that means 8th August, 8th August, 8th September, 8th October. So automatically here it will take the date 8th October 2024.
Okay.
Again, month 6. So from October, again 6 months, it will automatically calculate and it will only take the date. So that's the reason. If you are going out of the window period of the visit date, then automatically it will raise the query here. This is not the visit date of the patient as per the protocol. Like that it will do. Then you have to check whether protocol deviation was filed for this particular out of window period the visitor or not. Like that you have to cross check.
Okay.
Next, subject details, informed consent form, demographic details, like that. This will be in a single tab. So whichever the tab we want to fill, that tab first we have to click. First, for example, informed consent. This tab, if you are clicking, it will show you the details of whichever the one you have to enter for the informed consent. For example, lab data. Lab data, if you click, it will give you like this in other tab. Serum urea, whichever the lab test we are going to perform on the patient, those all lab tests it will show here. For this lab test, you have to write the result and whether it is a clinical significance or non-clinical significance also we have to give. I said you what is the meaning of clinical significance and non-clinical significance. Did you remember?
Yes, ma'am.
What is clinical significance?
That whether when we are doing a blood test and whether it will be in a range. So if it is above that, it
above or below the normal
below.
range. Okay?
Yeah.
If it is above or below the normal range, then it indicates that it is clinically significant. That means it needs some treatment. So then at that time, what we have to do? We have to go to the con medication and we have to check whether medications are prescribed for the abnormal condition or not. If, for example,
Yes.
in simple way, I can tell, like, you can, if you are seeing hemoglobin value is very less to the patient, or it is very more to the patient. It should not be very less, or it should not be very more also, right? So immediately you have to go in the con medication, and you have to check whether for the anemia condition of the patient, medications are prescribed or not. Or we are having more RBC. Then if you have more RBC, thinning of blood will be more. So thinning or clotting of the blood will be more. So for that, whether thinners or anti-clotting medications were given to the patient or not, those kind of things you have to cross check. That's the reason we should be able to think in a medical way when we are reviewing the document. Simply, we cannot scrolling and seeing the data. We should think in a logical way, and we should check the CRMs. And sometimes what will happen is, for some of the patients, as per the as per the doctor's decision, in addition to visits that are mentioned in the protocol, some extra visits also will be doing to the patient. For example, if the doctor wants to know his condition in middle of the study, even though there is no visit, he wants to know the condition of the patient. Then he will schedule an unplanned visit. That visit is called as unplanned visit. So for every patient, there will be one tab for this unplanned visit. If any of the patient that kind of visit has happened, then they will enter those details here. What is the unplanned visit number? What is the visit name, actual visit date, and visit status. Visit status is nothing but whether it is performed or not. Okay? Those
Okay.
details will enter into the unplanned visits. And as I said, whenever you like, you have to go into this production, you have to check all the data, and whichever the like whatever the queries you have to raise the queries. Then directly site people, they will enter into, like, they will not go to each patient and they will not check. Simply they will click this discrepancy management, and if you click the discrepancy management, whichever the queries that were given by you, it will be showing in red color for them. By seeing that one, they will resolve the query, and they will save it. Then you also, when you want to check whether the queries are resolved or not, you can open the discrepancy management, and you can see if it is resolved by the site team, it will show in green color. And again, you have to cross check that one, and you have to tick that one. If you are ticking that one, that means that the data is cleaned. Understood?
Yes, ma'am.
Okay, so like that, you have to check whether all the data is cleaned or not. Once all the data is cleaned, you will freeze the data. Freezing the data we'll do before the database lock. Freezing the data is meaning that once you freeze the data, no one can no one can again um, manipulate the data or edit the data. That is called as freezing. After freezing is done, we have to take approval from the sponsor or from manager of the CRO. For everyone, from everyone, we have to take the approval, and then we can do the we can log the data. Database log can be done. Okay, this is
Okay.
the DMP for PGC studies. Next, one more topic I'll tell you. Give me 2 minutes. I have downloaded it morning, that PPT, but it's not getting opened. Now I'll once again try. If it is opening, I'll take that one. Otherwise, tomorrow I can show you. Okay, now it's opening. Is my screen visible to you?
What, ma'am?
Is my screen visible?
Yeah, now it is visible.
So next one is data validation and edit checks. First, we should know what is meant by data validation. Data validation is nothing but here we are checking whether the data that is entered in the CRF is as per the protocol, as in accordance with the protocol or not. That is called as the data validation. And this data validation, it will be done by keeping some edit checks in database. As I said you previously, we'll keep the data edit checks for visits. We'll keep the edit checks. Then for some of the lab values, as we'll have the reference document with us, as we know the normal lab values range for the different tests involved in the study, we'll keep the edit check. So whenever the site people is entering data below or above to that normal range, then it will not allow the data and it will automatically raise a query. So like that, by keeping the edit checks, we'll validate the data. This validation mainly, this is one of the part of good good clinical practice, and this is mainly required to to maintain a high quality data, which will help for the statistical person to do the analysis in an easy way. That's the reason CDM people mainly, when they are checking the data, they will do the validation also for the data. So what is the data validation activities flowchart? Let's see. So once the investigator site completes the CRF, that CRF will be received by DM team. Then they will manually review all the data. So then after the data entry is done by the site team, then edit checks will be done first. Once the edit checks are done, automatically it will raise queries. So that queries will go to the site team. In addition to those edit checks queries, the other queries will be given by the data management team to the site team. 1 minute. Sorry, this is the other thing. As I said you previously, first, no, in not investigator side here, it is wrong. It is medical writer. Okay. Once the medical writer completes the CRF, that CRF will be reviewed by the CDM team, and they will pre-entry manual review. It's like just that CRF they will manually review, and they will keep the edit checks for the data. Then the data, these all edit checks and the final CRF, it will be shared to the database developer, and that database developer, he will update the database. Then final CRF received by the CDM. Then whenever the final CRF, that means the CRF which is finalized one, that will be received by the CDM team. They will finally validate the data by UAT testing, user acceptance testing, whichever I have said you. Then the database will be updated and database is freezed, statistical analysis and reporting. So here they have given the flowchart, how they have given is from first to last activity, they have given very less. So whichever I said you the process that you remember. Okay.
Okay.
And what is edit check? As I said you, these edit checks are mainly help us to identify the discrepancies in the entered data, mainly in the visit dates, lab data, and then age of the patient, gender of the patient, so many, whichever are there in the CRS. But we can do the edit checks mainly for this date kind of things, the scheduled dates as per the protocol, or the schedule, or the reference ranges for some lab values. For those kind of things only, we can keep the edit checks. Edit check, how the edit check process flow will be there. So first, CDM people only will prepare the edit checklist sheet, because they only can know where they can keep the edit checklist. And that one again they will share with all the team members by sending the protocol. So team members also will check whether these edit checks are good to keep in the EDC or not. Once they feel that these all are okay, they will finalize and they will keep the edit checklist. Then the team will review and approval. Then after approval, the final edit checklist they will prepare, and that final edit checklist they will send to the data programmer to keep that to keep those specific kind of edit checks in the database. Mainly, as I said you, what are the examples of edit checks? Missing data or blank file checks. Sometimes what will happen is in some of the tabs, site people will not enter the data. They will miss the tabs. So if they are missing the data or they are keeping the file blank, then it will automatically raise the query. Point by point check. As I said, you point by point check is nothing but their prior medication history, con medication history, whether they kept ongoing yes or no for the prior medication, those kind of things. Next, data consistency check. Data consistency check is, for example, they have mentioned drug name and units are not mentioned. For example, 500 mg, but mg they have not mentioned. Then it is a kind of, they will keep a edit check for this one also. Whichever the drug name we are mentioned, for that one we have to mention the composition also. Okay. Next, laboratory data and range check. This I have explained you. Discrete value group check. Discrete value group check is nothing but sometimes there should not be a decimal, but they will keep a decimal. Like 500 mg of a tablet, but they'll keep 50.12. No way 50.12 mg of drug will be given, or will not have those kind of drugs also. Like those kind of discrete values, that for that also edit check will be kept up. Header inconsistency check. This header inconsistency check, it is not for EDC studies. Protocol violation check. Protocol violation check is nothing but violation in the visit schedules. Next, coding check. Even this coding, whichever we are giving for the diseases, medical coding we are giving for the diseases, we cannot give as per our wish. There will be one dictionary called as MedRA dictionary. Okay, in the dictionary, for every disease, they'll give some codes. That codes only we have to use.
Okay.
Okay, so whether the code that is given for the disease is as per the MedRA or not. Next, duplicate data check. Sometimes what site will do is, for two patients, they will keep the same data by mistake.
Okay.
Instead of entering one patient data, they will enter the same patient data for the other patient also. So those kind of double duplicate data check also, it will give the edit check. Next, textual data check. Textual means sometimes spelling mistakes. If you are entering the drug name wrongly, those kind of things, it will give the queries. So these are some examples of the edit check. So most probably automatical queries will be raised for so many of the simple manual mistakes. Only here data management has to check is some logical kind of things and some scientific kind of things, because that system, those kind of things system will not know, right? Only the specified qualified person only will know. That's the reason those kind of things, edit checks will not be there. That will be checked by the data management team only. So for these all things, again, they have given the data is mentioned. For example, next, consider AE record where fever is reported with action concomitant medication. So this they have given as an example. The AE is fever. Start date is 14 June 2024 and stop date is 21 June 2024. Action is for that fever, they have given concomitant medication. Outcome resolved. Next, now consider concomitant medication record where paracetamol report. So here they have given for fever, the start date is 14 June and stop date is 21 June.
20
Okay?
minutes.
So in concomitant medication, how it should be, the medication for fever is paracetamol. Start date is 21 June 2020, 22 June 2024. But here what they have mentioned,
14 June 2024.
so here this is a wrong one. Stop date also only 22 June they have mentioned. So this is a wrong one. So for this kind of things, automatically the queries will be raised. If you see here, paracetamol has not given in the appropriate time frame, hence data is inconsistent. Because after stop date, the paracetamol was given, right? So this is an inconsistent data. For this kind of things, they will keep the edit checks for these kind of things only, and it will automatically raise the query. 1 minute. Next is hematology. WBC range is, this is the normal range, but we got the range out of normal range. The date is 14th March. For this one, they have given like for it will be recorded even if the lab ranges are out of the range also, that is considered as AE only. So AE record also we have to check if the lab values are out of range. So here if you see in AE record, that is called streptococcal. Here whenever we got the report, that date should be mentioned, but here they have
Yeah.
mentioned the previous date.
13th March, yes.
So these kind of things we have to cross check. Next, dates out sequence refer to the dates in header of the body of the CF. For example, where one screening record is reported with an incorrect year. So here everyone is mentioned in 2024, but medical history is mentioned 2023.
2023.
So these kind of things. That's it. These ones you have to remember, and I'll share this PPT with you. You can read this
Okay.
PPT and you will understand. As I said, these dictionaries also you can refer when you are free. MedDRA, CoStar, these are some medical coding dictionaries. Okay? They will be available.
Okay, ma'am.
This MedDRA will be available. You can check this one to know the medical coding.
Okay.
Okay. So up to for today we can stop this, and tomorrow again I'll take the other topic.
Okay, ma'am. Tomorrow in same like today morning.
Tomorrow 11 to 12 I have parents teachers meeting. Tomorrow when you will be available morning? Not like 11 except 11 to 12.
Ma'am, when it is okay for you?
Afternoon are you free?
Yeah, ma'am. Tomorrow, I guess no problem. Till now, because my mother will be there.
Oh, then afternoon